Welcome to the Wilmington Health HIPAA Privacy Training. The purpose of this training is to provide you with a brief overview of HIPAA and to also define how Wilmington Health has implemented the HIPAA-required directives into our daily operations. What is HIPAA? HIPAA is an established set of national standards focused on the protection of certain health information. There are two important pieces of HIPAA. The first is the privacy rule that was enacted in 2003, and what the privacy rule does is it defines how we as an entity can use or disclose PHI, protected health information. It also strikes a balance between the use of PHI and the protection of our patients' privacy. The second instrumental piece is the security rule that was enacted in 2005. The security rule defines what safeguards must be put into place to protect PHI within our organizational operations. Who are the Wilmington Health HIPAA officers? The most important officer for all staff to be aware of is the privacy officer, Tina Ashworth. The privacy officer can be contacted at 796-7701 or by emailing privacyofficer@wilmingtonhealth.com. The security and compliance officer is Chris Bunch, our Chief Operating Officer. Notice of privacy practices are required by every entity to be available to their clientele. For the Wilmington Health Notice of Privacy Practice, I outlined the four most important directives contained within it. The first is that our privacy practice describes the ways PHI is used and disclosed within our organization. It also states the measures and safeguards that we have put into place to protect our patients' privacy. It describes the individual's right to complain if he or she feels his or her privacy rights have been violated. And last, it includes a point of contact for further information and to file a complaint report, and that would be our privacy officer, Tina Ashworth. What is PHI? PHI is anything that can identify a patient in any operational system we have that is held or transmitted electronically, verbally, or on paper. Primary identifiers include an individual's demographic data, past, present, or future, that includes name, address, any related dates such as date of birth, date of admission, date of discharge, date of death, telephone numbers, social security numbers, medical record or account numbers, email addresses, photographs, and device identifiers. There are two general principles of HIPAA. The first is the basic principle, which defines and limits circumstances surrounding the use and disclosure of PHI. There are two exceptions to the basic principle, and that is when the privacy rule permits or requires the use or disclosure, or when the individual or the individual's representative authorizes it in writing. Required disclosures is the second principle. There are two instances where we, as an entity, are required to disclose PHI. First is to an individual or an individual's representative who specifically requests access to or an accounting disclosure of his or her PHI. The second is to the Health and Human Services Secretary when the department is undertaking a compliance investigation, review, or enforcement action. The HIPAA hand. The HIPAA hand is a general reference for all staff to use whenever they're in a situation where they're uncomfortable using or disclosing PHI. We recommend that they stop and think about what they're doing and review the HIPAA hand to make sure that the use and disclosure does touch one or more of the fingers. To define these, the first is treatment. Treatment is the provision, coordination, and management of health care for an individual by one or more providers. Payment encompasses activities related to registering, processing, and obtaining payment for the provision of health care to an individual. Healthcare operations include quality assessment and improvement activities, competency assurance activities, conducting or arranging medical reviews, audits, or legal services, specified insurance functions, business planning, development, management, and administrative activities, as well as business management and general administrative activities. To the patient. It is always permissible to disclose information to the patient. It is one of the 2 required disclosures specified by the privacy rule. Authorized by the patient. A patient may give us written authorization to use or disclose his or her medical information to anyone for any purpose. This authorization can be revoked at any time. A perfect example of this authorization is when patients initially register with our organization as a patient. They are required to define on their HIPAA form who we can use or disclose their PHI with. For example, you can share it with my husband, but not with my children. The patients drive who we use and disclose their medical information to and with. Minimum necessary. HIPAA required every entity to develop and implement policies and procedures that define minimum necessary use and disclosure, and require that the entity make reasonable efforts to use, disclose, and request minimum PHI to accomplish the intent of this use, disclosure, or request. An example of minimum necessary would be if we referred a patient to an external provider, we would only send documentation to support that referral. When the necessary standard applies, the entity may not use, disclose, or request the entire medical record for a particular purpose unless it's justifiable. An example of this would be when a patient is referred into Wilmington Health for a consultation. For our specific specialty departments, each has requirements of what information we need to perform that referral. For example, endocrinology would need patient information, demographics, and insurance, as well as current office note, labs, potentially ultrasound reports, or different diagnostic studies. We would only request the minimum necessary, again, to support that referral. That is what minimum necessary is. Mitigation. A covered entity must mitigate, meaning to make less severe, any harmful effect involved with any inappropriate use or disclosure of PHI that violates its policies and procedures. An example for staff is when PHI is faxed to an incorrect fax number, the expectation for mitigation would be that that individual contact that office, communicate the mistake, and request that the destruction of the contents of the fax occur immediately. Inappropriate use and disclosure requirements. Anytime PHI is inappropriately used or disclosed, we as an entity are required to complete an accounting disclosure form. This accounting disclosure form includes the date of the disclosure, what was disclosed, the purpose of this disclosure, and the name and address of each person to whom the disclosure was made. This form is scanned to the patient's chart and is utilized when a patient requests an accounting disclosure of his or her PHI. Patient's rights. There are 2 required patient's rights and 3 discretionary. The first required is access to. Individuals always have the right to review and obtain a copy of their protected health information in a designated record set. If and when a patient wants to review their medical records, the appropriate channel would be to contact the medical records manager, Tina Ashworth, and schedule a time to review his or her medical record. The second required is disclosure accounting. Individuals have the right to an accounting of the disclosures of his or her PHI. If a patient contacts the organization and requests that they be informed of who has used, been exposed to, or disclosed their PHI, they will contact the HIPAA Privacy Officer, again Tina Ashworth, and schedule an appointment to review the disclosure accounting. The HIPAA Privacy Officer will obtain data from our operational systems of individuals and an accounting of those who have used and disclosed this patient's PHI, as well as obtain copies of any scanned accounting disclosure forms. These will be reviewed with the patient, along with an explanation of every encounter of the use and disclosure of this patient's PHI. The discretionary rights include restriction requests. Individuals have the right to restrict the use or disclosure of PHI for treatment payment or healthcare operations that are involved in his or her health care. Again, when patients register with Wilmington Health, a portion of their new patient HIPAA information allows them to designate who we use and disclose PHI with. Confidential communication. Individuals can request alternate means or location for receiving communications of his or her PHI. A perfect example of this is our auto appointment reminder system. Some of our patients prefer the call go to their home phone instead of their cell phone, or vice versa. Some patients wish to not receive the appointment reminder call at all. Our patients drive their confidential communication of their PHI. Amendment. Individuals have the right to request amendments that are within reason to his or her PHI when the information is deemed inaccurate or incomplete. The important piece to this amendment is that the amendment is always an addition to, it is never an omission of, documentation. An example that we have been involved with within Wilmington Health is we may have documented the patient was a male when indeed it was a female, or that the patient smoked when they have never smoked, and we then post an amendment to this individual's EMR chart. The Sanctions Policy of Wilmington Health is the disciplinary action related to any inappropriate use and disclosure of PHI. As employees of Wilmington Health, there are specific expectations regarding workforce behavior in relation to safeguarding patient PHI. We ask employees to never overstep their boundaries or overstep the privilege of being an employee of Wilmington Health. The first expectation that we emphasize is for our employees to never access theirs, a family member's, a friend's, or any other patient's PHI that is not directly involved with the performance of his or her job roles and responsibilities. Our workforce should never share his or her password information. They should never leave their workstation without auto-locking the screen. As a safeguard, our IT department does have an auto-set lock on the workstations. What we ask of staff is that at any point in time that they walk away from their workstation to please hit Control-Alt-Delete and lock their system, or hit the Windows key and the L button to lock their screen. This is an extra safeguarding measure that is not dependent on our IT safeguard auto lock. The related disciplinary actions for any inappropriate use or disclosure of PHI start at Level 1. Level 1 is when the violation is an unintentional error or mistake involving an internal breach of confidentiality. This is a verbal counseling, and it is not included in the personnel file. An example of this internal breach could be something as simple as handing a patient an incorrect router, or walking up to a copy machine and making a copy of something that has PHI on it, forgetting the original copy, and having another coworker walk up and get exposed to that PHI that was left on the copy machine. The Level 2 violation is an unintentional error involving an external breach of confidentiality or repeat of Level 1 actions. This is a written warning, and it is included in the individual's personnel file. The external breach could involve something like faxing information to the wrong fax number, or mailing a patient another patient's PHI. Level 3 violation is an intentional disregard of clinic policy with no malicious intent or repeat of Level 2 actions. This is a written reprimand with a loss of PDOs. This level of disciplinary action is where the HIPAA privacy officer starts identifying individuals in the workforce who have indeed obtained PHI on individual or individuals that was unrelated to this workforce member's job, role, and responsibility. The HIPAA privacy officer performs a quarterly audit of random employees to ensure that our staff are aligned with their expectations regarding HIPAA safeguarding of PHI. The Level 4 violation is a purposeful disregard of clinic policy with potential for more severe consequences or repeat of Level 3 actions. This is a 3-day suspension without pay. Level 5, the violation is a malicious disregard to clinic policy or repeat of Level 4 actions, and it is automatic termination. Workforce compliance. Any member of the workforce who suspects that the HIPAA privacy policies, procedures, and rules have been breached are expected to report the suspicion to the privacy officer immediately. The privacy officer for Wilmington Health, Tina Ashworth, will perform a thorough investigation geared to prevent or mitigate any deleterious effects. Reports by workforce members can be made anonymous. Complaints. Every complaint received must be documented and referred immediately to our privacy officer for investigation and resolution. Complete and timely cooperation from workforce members with the privacy officer is expected from all entities involved in the investigation. Media controls. Electronic protected health information may not be removed from Wilmington Health premises via electronic media without the approval of the security officer or the IT manager. Safeguarding measures such as encryption must be implemented in order for electronic media to be removed from Wilmington Health premises. Notification of viruses and similar threats. Due to the opportunity for loss of PHI security that viruses create, staff are instructed to immediately shut down his or her computer at the source and notify the IT manager and/or security officer immediately. Protection from malicious software. Only software approved by and/or purchased by the Wilmington Health IT manager shall reside on Wilmington Health computer sources. Any software request must be channeled through management, then to the IT manager prior to installation. You will receive an administrative block with any attempt to install any unapproved software. Electronic transmission security. Wilmington Health providers and staff will not electronically transmit PHI through any means other than those provided internally. Transmitting PHI using Internet, that being external communication, is strictly prohibited unless the PHI is encrypted. Communicating PHI via internal communication is allowed and is secured due to employees logging into our Outlook system using a username and password. HITECH breach notifications. This is simply a piece of information to let the workforce members know what Wilmington Health is responsible for if the organization breaches large amounts of individuals' PHI. If we breached more than 500 individuals' PHI, we would be required to report this breach to the Health and Human Services Secretary Office and to all local media outlets, these including newspapers, radios, and television stations. We would also be listed on the HHS website as an entity that did breach this count of individuals' PHI. If we breach less than 500 individuals' PHI, we are still required to report this breach to the Health and Human Services Secretary, but we do this on an annual basis when they come in for their annual HIPAA review. Workforce and visitor identification. Workforce members must display proper identification at all times while on any Wilmington Health premises. Visitors should be issued a visitor badge or some type of identification upon entrance to any facility. Workforce members are expected to and should question visitors who do not display proper identification and direct the individual or individuals to the appropriate desired location. This concludes the Wilmington Health HIPAA privacy training. With any questions, concerns, complaints, or suggestions regarding HIPAA or HIPAA safeguarding procedures, please contact the Wilmington Health HIPAA Privacy Officer, Tina Ashworth, at 796-7701 or at privacyofficer@wilmingtonhealth.com.